This meeting is now being recorded.
The PowerPoint slides from today's webinar are available for download in the Files section. It's up at the top of your screen. If you go to that, there's a PDF of the slides. And make sure you download those before you exit if you're interested in having them. Just a note, there will be a link to an evaluation form sent to you after this webinar. We would appreciate any feedback from you. And the webinar recording is going to be available on our website within 10 business days. So if you want to come back in and watch again, in case you missed anything, it will be available to you. At this point, I would like to turn it over to our presenter, Lisa Newman from ACA & Associates. Take it away, Lisa.
Thank you. Lisa Newman, Benefit Consultant at ACA & Associates. I've been working with Wegner for a while now. I actually work with a bunch of employer groups in the Dane County and surrounding area here on the Affordable Care Act. So we're doing this in conjunction together with Paula, the payroll coordinator, to educate you on the Affordable Care Act. You've probably heard a lot about the Section 6056 reporting that is coming up, and we're going to do basically a 101 of that. I always start out by saying the Affordable Care Act is over 40,000 pages high now. It is over 7 feet from floor to ceiling, so there's a lot in this document. A lot goes over the Section 6056. There may definitely be questions that you have out there that we might not be able to answer today. We do have a full HR team with attorneys on staff that we will look into your question if it is something that we aren't able to answer today. And we will get back to you with that. But what we are reviewing today is the Section 6056, the reporting overview and the deadlines. We're going to be looking at the information to be reported. We're looking at what type of penalties if you don't report. We're going to be showing you methods of reporting and what the forms actually look like, and talking about affordability of plans. The main point that we're going to be covering today is, again, the Section 6056, and that is for applicable large employers with 50 or more full-time equivalents. That is what we're going to be focusing on. We're going to talk about how you're going to determine if you're 50 or more full-time equivalents, how you're going to be doing that. If you are under 50 full-time equivalents, this actually isn't going to pertain a lot to you because your insurance carrier is going to be doing the bulk of that work for you. But for purposes of today's meeting, that Section 6056 is for employer groups with 50 or more full-time equivalents. We're going to be looking at the file information that is going to get sent to the IRS. And then the second thing that you have to do is you actually have to provide statements to full-time employees. It's going to be at the same time that you're sending out a W-2, and we're going to show you exactly what that form looks like. The purpose of doing this Section 6056 for the government is so that the IRS can administer the employer shared responsibility rules. We're going to talk about that in detail too, but they want to make sure that your plan is meeting the minimum value and that it's affordable. And if it's not, there are penalties that could apply to you and your group. Reporting deadlines for 2015. The IRS report returns does have a deadline of February 28th. If it's filed electronically, that deadline is March 31st. The individual statements have to actually go to every employee by January 31st. So just like your W-2 that has to be sent out, this will be sent out along with it. And again, we're going to show you what those forms actually look like here. The IRS returns is an actual electronic filing is required for reporting entities that file 250 or more individual statements per calendar year. So you do have to file electronically if you have over 250 statements to go out. The individual statements will go to every single employee, and you will provide them by mail to the last known permanent address. For purposes of today's meeting, we're really focusing on the insured plans. Again, if you are a self-insured plan, you definitely have to provide these documents. If you have an insured plan like Dean, Physicians Plus, Unity, GHC, Blue Cross, WPS, United Healthcare, whatever that is, you will be filing and sending in the Form 1095C and the 1094C. If you are a self-insured plan, you are also doing this as well. Penalties. There is penalties if you do not send individual statements and you do not file your return to the IRS. They have been very adamant that they want all businesses with 50 or more full-time equivalent employees to definitely, you have to file a return, at least make a good faith effort on this. Penalties, I don't want this next slide to scare you. Oh, sorry about that. They've given very basic rules on penalty amounts. They have stated that the old penalty used to be $100 per employee per day, and with the new Affordable Care Act rules, upping it up to $250 per employee per day in violation. Again, I can't imagine that a penalty would be that great, but those are, they're giving very general maximum penalties out there. Basically what we want you to know is that there will be penalties if you don't do this. So if you have 50 or more full-time equivalents, make sure you are completing the necessary forms. If you have completed the forms and they're incorrect or incomplete, you have the wrong codes, you're going to see as we're going through this, there's a lot of codes that have to be put on these forms. Let's say you put a wrong code somewhere. This first year, they're going to say, okay, you've made a good faith effort, we're not going to give penalties because of that. But they are not going to say there are no penalties if you just completely don't do this. If you say, I'm not sending in any forms, I'm not doing any individual statements, I don't care, I'll see what happens. The IRS has said there will be penalties. So the point in being this, at least make the good faith effort in 2016, might have a wrong code here or there, they're working with you on it. Obviously, as this thing goes along, they'll keep increasing things and want it to be more smooth, obviously. Now we're going to talk about the actual reporting entities. An applicable large employer is subject to the employer's shared responsibility provisions. So what is the definition of an applicable large employer? That is an employer that is employed, on average, at least 50 full-time employees during the prior calendar year. This does include full-time equivalent employees. Common-owned companies. This is a tricky one, very tricky. It's so tricky that we have, at ANSA, we have an HR team that actually evaluates if your group is common ownership or not. I do encourage you, Paula and I both have our email addresses at the end of this presentation. If you are a commonly owned company, you have a couple different companies with certain percentage shares, I encourage you at the end of this meeting to send an email out to myself, Lisa Newman. We can talk with my HR consultant and our attorneys on staff to determine if you are common ownership or not, because it has different common ownership rules for the Affordable Care Act than regular common ownership rules. So it's very tricky, but we can get our HR and attorneys on staff to help you through that. For purposes of this meeting, we are looking at that every employer that has at least 50 full-time equivalent employees is having to report the 6056. And what is an actual full-time equivalent employee? Well, what you do is every single month you're taking your full-time employees and you're actually counting them. So every month, everyone that has 30 hours of service or 130 hours in a calendar month, they are a full-time employee. So if you've got 65 people that are in this scene right here where they work over 30 hours, you're definitely full-time. You have over 50 full-time equivalents. So you take these full-time people, and then you also take a part-time employee. People always ask, how do you calculate a part-time employee? Well, you take their hours of service for their part-time employee, and you're adding all of them up for the month. And you are dividing it by 120 hours per person per month to get your number of full-time equivalent employees. So again, you're taking up your full-time employees right away, and then your part-timers, you're adding it all up, dividing by 120 to get your full-time equivalent. With that calculation, if you are at 50 or more full-time equivalent, you will be required to do the 6056 reporting to the IRS, including the individual statements. If you are under that, the insurance company actually takes care of that for you. If you are self-insured, whether you're under 50 or over 50, you do have to comply with the reporting requirements. Again, Paula will be chiming in at the end here at Wegner. Her email address is at the end of this PowerPoint. She can also help you determine if you are full-time equivalent and how many employees you have. She's definitely been helping people out with that. Again, medium-sized applicable large employees are eligible for the one-year delay, so we didn't actually have to do this. For groups 50 to 99, we had a delay. We didn't have to do this in 2015, but we do have to report this in 2016. So this part is a little confusing also, but we're determining our full-time equivalents based on 2014 data, but we are using our 2015 monthly numbers when we send our information to the IRS and when we send out our individual statements. So again, all of this is due in 2016, but we are using all of the data from 2015. So let's take a look at the information that is to be reported on here. There are two different forms. It's called a 1094-C and a 1095-C. This 1094 is the actual report summary that's going to go straight to the IRS. It's going to certify eligibility for transition relief, and you're actually submitting the forms, the 1090C forms, to the IRS. These 1090C forms, we're going to show you what these look like too, but it's report information about each employee. You satisfy the combined 6056 reporting requirements. So why are we doing this? What is the purpose of this reporting? The main purpose is so that the IRS can, number one, make sure that you as a group are providing a minimum value plan to your employees. That's number one. They need to make sure that your plan is at least 60% actuarial cost. The second reason that we are doing this is because the government says we cannot have a plan where an employee is paying over 9.66% of his or her income for health insurance in 2016 coming up here, or 9.56% was the income in 2015. So there's two parts of it. One, you have to have a health insurance plan if you have 50 or more full-time equivalents. You have to. And it has to meet the minimum value or you will get fined from the government. Number two, if you don't have a plan that's not meeting this 9.56% income for 2015, 9.66% income for 2016, there could be penalties there as well. This is where, as a broker at ACA and Associates, this is where I help my groups, obviously working with Wegner and others in the area. I help them determine that they have a minimum plan and also help them determine that they've met their income threshold. Again, my email's at the end of the PowerPoint. If you do need help doing that to make sure that you have met the minimum value and that you have met the income threshold for your employees, please email me and I can definitely take a look at your individual plan and help you out with that. Let's actually take a look at these forms so you can see what they are. The 1094C is the actual transmittal form, and again, you have access to this PowerPoint after the meeting, so you can go on in and look at detail in these forms. But you're filling out information for your group. You're listing the total number of 1095C forms that are submitted with this transmittal. You're also filling out again, here the total number of forms 1095C filed and on behalf of the applicable large employer member. And then you're putting on here monthly, if it's a full-time employee, if you were with transitional relief between this 50 to 99 relief. As you can see, these are the parts that they get a little confusing as to all of the codes that are on here. This is also one of the reasons why the IRS has given a sense of relief this first year. If we have a code wrong, they're not penalizing us for a wrong code, but they are going to penalize us if we just completely pretend that this didn't exist and we weren't going to do any of these forms at all. This 1095C is the actual part that is going to be sent out to each full-time employee. So you can see name, Social Security, address. You're going to put your employer information on here. That is going to go to each individual full-time employee. And you're entering a
Sorry
code
to interrupt.
indicating...
We do have one question. Sorry, I was going to back up really quick. Joe would like to know, is it true that you do not get fined until your 31st employee that doesn't meet the 9.66% figure? Essentially, he's wondering if you get 30 freebies.
There is how they're doing it this first year is, yes, there is a 30, kind of consider it like that, a 30 freebies, and then the 31st employee is where the fines would start. They're stepping this. I haven't heard yet if they've come out with what the 2016 number will be yet, but yes, for 2015 you do have the 30 freebies first. Thank you. This is what the 1095C form looks like, and as you can see, there's a lot of codes in here. You're putting your qualified offer because you're giving them coverage, and most you're putting 2C, employee enrolled in coverage offered. This again is where Paula and the Wegner team, she'll jump in at the end here, but they are obviously helping you and your group if you do decide to utilize them for this. It can be confusing. There's a lot of different codes in here, and the team's definitely here to help. Most are going to have employee enrolled in coverage offered because they're just on that. And as you can see, it goes by month, January, February, March, April. So you're actually listing what code every single employee had for every month. Employers with self-funded plans will complete one 1095C form for each employee who enrolls in the health coverage, whether they are full-time or not. That is for self-funded plans only. Just a quick example, a company has applicable large employer that has 89 full-time employees. An additional full-time equivalent employees, they have 40 full-time employees, but full-time equivalent, they have 40 full-time equivalent, but altogether it comes to 89. So they are a company that they're offering an affordable plan. Mary enrolled herself in coverage beginning January 1st, 2014. Again, just a completed version of what the 1094C form looks like. And again, this is all out on the website that you can take a look at this, download, print it, use it as you'd like. This is a copy of the 1095C form, so you can see where they're putting in the codes here that we went back to in some of those slides. I'm going to turn it over to Paula.
Okay.
So she can talk about the services.
Okay. Can you hear me? I do have more information available about what the service that we provide does include, and I wanted to mention that we do have a worksheet on the Wegner website, and that you are welcome to use that as a resource. I'm trying to think of what else we maybe have to mention. One of the things I did want to mention, and Lisa can tell me if this isn't correct, but I do believe that when you calculate up all your employees, and and for example, say you have 90 total employees, and you calculate that you have 53 full-time FTEs, and so you have to report. The only employees you would have to provide forms to would be the employees working 30 hours or more per week, even in 1 month, though. So you'd have to go through that process, and that's all stuff we would cover when we would help you go through gathering this information. But I thought I would try to mention that. Lisa, let me know if that's not true. I'll turn it back to you.
Yep, correct. So again, a lot of information that was given today, a lot of forms, a lot of codes. We're here, Paul from Wegner is here obviously to help you out with it.
Lisa?
I'm also available.
Lisa, I have one more question here.
Yeah.
The information is, Lori would like to know if the information submitted is for 2014 and not 2015. Here's the confusing part. 2014 is the information you use to determine if you need to report, but you will be reporting information from 2015 and submitting it in January 2016. Is that correct, Lisa?
Correct, correct. So if you're on the bubble of that 50 full-time equivalents, again, if you're at 150 full-time equivalents in 2014, 2015, you're going to have to report. You just have to. But yes, you're using 2015 data. You're using 2014 numbers if you're on the bubble with this 50 full-time equivalent to determine if you are over 50 full-time equivalents or more. It's confusing, but yes, that's correct. And we'll be going through these questions too. If there's some we missed, we will be able to email you out answers as well. But again, our information is here. Please use us as a resource. The 40,000 pages of the Affordable Care Act keeps growing and growing and growing. This is obviously a huge portion of what employer groups with 50 or more full-time equivalents will have to do in 2016. So please continue to use both of us as resources. We are here to help you out, and we do thank you very much for your time.
Thank you for your attendance, and appreciate your listening today. Thank you.
Okay, thank you, Lisa and Paula. Please remember that we will have the slides available to download in your Files section. I know in the chat section we had some issues with that file being there, so we will send it out with your evaluation form. Please watch for that follow-up email with a link to the evaluation form. We would appreciate you providing us with your feedback. Lastly, should you have any questions, again, please contact Lisa and Paula with any questions afterwards via email. And with that, this concludes today's webinar. We want to thank Lisa for sharing her knowledge and expertise this morning, and thank you to everyone for joining us. Have a great day.